I'm Carole Osborne, and I've been a body worker and massage therapist for the last 36 or so years. And during that time, I've developed my own way of combining rhythmic deep tissue work. So I'm using rhythmic movements and deep tissue. And I've also had lots of opportunities to work in the side lying position. So what I thought I'd show you today is a couple of techniques for using the side lying position, using the rhythmic deep tissue work. That's a little bit of a unique way to approach this, and work with the area that most of us work in our practice, the neck and the pectoral girdle. I like the side lying positioning for this for several reasons. I can get good neutral support on the neck, and I especially like that I can work on anterior and posterior structures in a good sequence to address that component in any upper back and neck problems that are occurring. So let me show you just a few of these techniques so you can get an idea of this work. This is a kind of a pat your head, rub your tummy kind of technique. So one hand here when I'm working with the trapezius is going to be doing a slow, gentle, but firm compression on chronic tension, in this case with the trapezius. And the other hand is going to be engaged in a very small amplitude and slowly paced rocking movement. So one hand is doing deep tissue work, in this case my left hand, and the other hand is doing rhythmic movement, creating some stretch of the trapezius and the other underlying musculature as I work here. Because of the traction and compression components of this and their effect, their desired effect on the fascial system, this is a technique that takes a good 30 to 60 seconds for it really to create some response. So as I'm holding this on you, Dana, how's this starting to feel? You getting a little softening and melting happening?
Absolutely, yes.
Absolutely, great. So we could move from the trapezius, which is a broader muscle here, so I've used a broader tool. We can go to the nemesis of most of us in terms of our neck tension, the levator scapula. And as I zone in on that levator scapula, I'm using a smaller tool like my knuckle. Once again, I'm going to do deep tissue work. I'm pressing in, feeling for resistance in the tissue, feeling for any place at which her tissue yields and following that yield. And I'm also going to just make sure with Dana that that's not any more than pleasure on the borderline of pain. Mm-hmm. How are we?
Very good.
Okay, good. So at this point then I can begin to make my rhythmic movements with the other hand. So my right hand is now making those rhythmic movements. So one other area that I'd like to show you with working with the neck and the pectoral girdle here is the occipital attachments. We can come in this position very nicely. I'm going to use my thumb now. My right hand's doing the deep tissue work. I'm going to use my thumb here at the occipital attachments, create some of that compression against those attachments and traction back with my other hand. And so now my left hand is doing rhythmic rocking movement. And I could work similarly all along her entire occipital ridge. I could work close to the mastoid, then make my way a little bit more medial and work the entire occipital ridge in this way. I mentioned about that anterior and posterior balance, and this is the place at which it's really helpful for me to be able to take the arm, and I'm going to use my fingertips of my left hand in this case, and I'm just inferior of the clavicle here in the pectoralis major attachments. And I'm holding my compression there. Again, this is 30 to 60 seconds as a minimum. And in order to accomplish some rocking movement here, I'm going to use the other hand to create, again, a nice slow traction. Or I could use it to roll her scapula forward or downward, do a downward rotation of her scapula and continue on with this deep tissue work at that pectoralis major attachment under the clavicle. Or, in addition, look how that rhomboid can be shortened with some little movement from my left hand while my right hand is accomplishing some deep tissue work at the attachment of the rhomboid at that vertebral border of the scapula. So I hope that this little demonstration will give you some inspiration towards putting movement and deep tissue work together, and the unique way that you can access the neck and the shoulder when you have your client in the sideline position.